Hi Mama! Welcome to this video. Welcome to the 38-week pregnancy update. In these updates we talk about what is happening to baby in the belly, what is happening to us mamas, and as well as how to prepare for birth and what to expect, especially that we are only 2 weeks away from due date now. So let's talk about our babies first. Our babies are now considered full term. 38 weeks is already considered full term. That's because all of the organs are now mature. They are fully developed. There will be still some fine tuning happening, and there will be continuous development happening in the lungs as well as in the brain, but they are considered fully developed now. The length of the baby is around 49 to 51 centimeters, and the baby can weigh around 3 kilograms. There is continuous rapid brain development, and the neural connections keep forming and keep strengthening, especially when it comes to newborn reflexes like grabbing. So baby has been practicing grabbing already since many weeks, as well as swallowing and breathing in and out the amniotic fluid, as well as sucking. So maybe you have seen in an ultrasound your baby sucking their thumb or their hand. These are skills that they will need in this world when they come and join us. So this is what they've been training as well. Their skin is smooth and there is a nice layer of fat now that is built under their skin. If they stay another few weeks, they will continue to put away these extra layers of fat under the skin, and baby will still be gaining around 200 grams per week. And the new thing that is quite interesting is that baby's intestines are currently full of something called meconium. So meconium is this dark green tar-like poop that they will release when they come into this world, when they are birthed. This can happen also before they are born, so in the birthing process, and this is usually a sign that baby is distressed and potentially needs a little bit of extra help to come out somewhat sooner onto planet Earth. So this is what is happening to our babies. They're practically ready to come and join us in this world. Super, super exciting. What is happening to us mamas? Well, we still have the pelvic pressure, and it could be building even further as the baby is dropping further. I can definitely see that in my belly, that the belly used to be up here and now it's dropping further and further, so it is lower, and therefore the center of gravity is also moving lower, which could result in further kind of lower back pain and hip pain as well. You might be experiencing this lightening pain in your pelvic floor sometimes. I have that if I'm in a rush somewhere and I'm trying to walk fast to catch the train, for example, then I suddenly feel this kind of tensing, lightening pain down there, which tells me it's good to slow down again, and that is what I then do. Braxton Hicks could still be happening, and more frequently than in the past. This is your body training the birthing process. And your cervix will be softening and thinning and starting to dilate in preparation for birth. So the question is, when do we actually know that the birthing process has started, that labor has started, and that we should call and inform our provider, the hospital or the midwife or the doctor, however you have planned out your ideal birth. So if you start getting regular contractions means every 5 minutes for 1 minute, so a contraction usually lasts around 1 minute. And this has been ongoing for 1 hour. So it could be that your contractions start at some point, but they're first going to be irregular, then they'll start being more and more regular. So do make note of that somewhere, or have your partner make note of that when they are taking place, and when they are around every 5 minutes for 1 minute for a full hour. That could be a good time to then call your provider and tell them that you are coming. Another sign is when your water is breaking. It might come out in a gush, it might come out in some leaking. Another sign is when you see your mucus plug, so you're going to see some stains, some blood coming out of your vagina. So that is another sign to inform your provider and start heading to the hospital or birth house or wherever you have decided to give birth. If you are feeling decreased movement and you start to get worried, you can also check that, of course. And if you are experiencing heavy bleeding and pain, that is a sign that something is also happening there. So these are the last weeks. We can continue preparing for birth, for labor, for when it comes. So we can practice breathing techniques. I have a separate video about breathing only. You can have a look also at the hypnobirthing discussion that I have with a hypnobirthing specialist, who also gives some tips there about relaxation and breath. What is super important is to stay hydrated, stay well rested, eat small, well-balanced meals. Soups are advised towards the end of pregnancy, as they are easier to digest, especially that indigestion could be speeding up towards the end of pregnancy as well. So soups often are recommended by midwives, by doctors, by gynecologists. You can also do a perineal massage. So that means you massage your tissue in your vagina towards your anus. So that area over there, you can use some natural oils or special perineal massage oils to do that. And you can do that daily for several minutes. There are also some other birth tips and tricks that I have learned from a TCM specialist. So one of the ways to prepare your body for birth, also mind, also to relax, is to go for a few acupuncture sessions. But there are other things that you can also do by yourself at home. So I will link also that video in the description box below, and you can watch that one and see what other things that you can do as well. And one more important thing to note and make sure you know where you have, apart from your hospital bag, which has the necessities for birth and after birth and a hospital stay potentially, and for your baby, is to know where to call. So I recently called my hospital that I will be giving birth at, where I'm registered, and was asking them whether they received my documents, actually, because I didn't receive a confirmation and thought that I should have. So they confirmed that, which made me a lot calmer. And then they reminded me that they did send this extra piece of paper on which they provided a specific number to call when you go into labor and the contractions are more regular, and when it is time to call to inform them that you'll be coming. So make sure you know where you're going, what number to call. This is super important. I've now stuck on my door and will definitely not lose that. So that is all from me. I hope that baby doesn't come tonight, and we're still going to be able to do some birth preparation, some breathing, some training together. So I hope to see you tomorrow. But I also hope you're feeling well, that you're feeling prepared, relaxed, and are ready to greet baby in this world, as it could really now happen at any point in time. Our babies are fully developed and they're considered full term. So good luck, Mama. I keep my fingers crossed for you. All the very best, and thank you for watching this video. Take care. Bye.